Hey, I'm hypermobile, and if you're listening to this, I'm guessing you might be too. Hi, my name is Alex, and I'm your hypermobile host, and today we are talking all about hypermobility and your gut. And this is one of those things that needs to be talked about more. So thank you for joining, and I hope that you maybe share this with a friend or talk with other people you think who might be hypermobile, because this is an issue which has a lot of stigma. Firstly, gut issues are embarrassing. We'll talk in a second about some of what's going to be in this episode, but it's not fun. It's also a sensitive subject. There are, I'll do the trigger warning now. Let's just get out of the way. There are a lot of issues here which are very sensitive and very challenging to talk about for a variety of reasons. There are people out there who have different kinds of eating disorders, and there is evidence to suggest that they are more prevalent in the hypermobile community. Of course, we're also going to talk about things that are just embarrassing for some people, like diarrhea and constipation. So if this is an episode, maybe you're listening to it with your kids. I don't know what people listen to these days for fun, but if you're listening to this and you want something which is definitely going to be a super family friendly, happy, yay kind of vibe, this might not be that episode, but it'll be really cool and really interesting. So without further delays, let's get started. So gut issues and hypermobility, they go together like peanut butter and jam. They are two things which I see for the most part. Now, I have to stress, again, my clinical role is as a UK registered osteopath, so I'm not a medical doctor, but I work with patients. They often come to see me because of their muscle and joint pain, and then I try my best to support them in terms of improving all the other stuff they have going on by making sure that they're getting that correct medical care and that correct medical management. But gut issues are one of those things I see in the vast majority of my patients. For me to see a hypermobile patient, so typically this will be someone with HEDS or HSD, occasionally another condition, or someone who's undiagnosed and on that diagnostic journey. But for me, I'd say probably close to 90% of my patients have gut issues. And bear in mind, my patient population are mainly people in their 20s and 30s. I do have patients of all ages, but I have a lot of patients on that kind of younger side, 20s, 30s, 40s, and so on. So for them to be having serious gut issues at this age suggests that there might be a link. Research, of course, is still ongoing. I'm going to talk about one study in particular in this episode, which is super informative and helpful, in which I suggest you maybe read or speak with your medical doctor about it. The whole point of what I've just said is gut issues are common, okay? However, there are the occasional patients who don't have any gut issues, and I'll be doing their medical history. And I typically start off, because I try to be sensitive when I ask people questions during a medical history. So I'll say, tell me about your relationship with food. That's how I typically open the door to that kind of questioning. And then this occasional, very rare patient will just be like, oh, it's great. And I ask them, any issues or, blah, blah, blah. And they're like, yeah, I eat pizza with no issues. I can do whatever I want. My gut function is fine. No issues with my stools, no family history. Everything's super rosy. And I'm just sitting there a little bit jealous, quite frankly, because gut issues are something that I do not personally have the best time with. But there are hypermobile patients who do not have gut issues. However, for the vast majority of people who do, this episode's for you. So I do have some notes with me today. You're going to see me glancing off them, okay? Because it's hard to remember all this stuff on camera. But gastrointestinal symptoms and disorders of the gut-brain interaction are common. So we need to think about why this happens a little bit and how we get that kind of connection. And we'll delve into that more later in this episode. But we know that people with anxiety often have altered gut function. We know that even in some neurodivergent conditions like autism, we're starting to see more and more evidence of gut dysfunction presenting in those individuals as well. And again, I'm not an expert on that subject, but we're seeing evidence clearly of a link between gut and brain function, which is not surprising when you consider that there are nerves that go to your gut and there's connective tissue there, and it all makes a complex system. Now, in terms of these individuals, these people who go on to become people who get disorders of gut-brain interaction, my hunch is that these are going to be people, and they're often hypermobile children, who are the ones who are saying hey mom, my tummy hurts when I'm sad. And if this is you, if you're an adult and your tummy hurts when you're sad, or your gut hurts when you're angry, or you feel things in your gut, maybe there's a link. But again, we don't have research on that yet. Now, in terms of causation, and correlation and association. What we can say about gut issues, and we're talking here things like diarrhea, constipation. We're talking about things like flatulence. In all honesty, I mean, you need to talk about it, because it's hard when you're a young person in your 20s, and you're trying to navigate all that, and then you're having issues with upset tummy and flatulence. That's embarrassing. Early feelings of fullness. We see things like rumination, where food is coming up when it shouldn't. We see things like different types of digestive pain. All of these different things we see in hypermobile individuals. And we know, and the researchers at this present moment are very confident in saying that there's certainly an association and a correlation. So we know that when we look at a hypermobile population, there is a greater, there seems to be evidence of some kind of a link between hypermobile individuals and gut issues that we see in people. However, as of this point in time, what is it? It's August 2023. Summer is almost over. We don't know the exact mechanism that's causing this. And I'm going to share my unresearched hypotheses on that today. So if this interests you, you're going to get to hear my theories. However, and by the way, I'm going to put some tips at the end on things that I do with patients, like little tips, strategies, things you can speak with your medical doctor about that might help you. So stay tuned for that. However, before we go any further, we have to talk about something really, really serious. And this is something I hate in my clinical work. It's the single hardest thing about my work. It causes me sometimes an overwhelming amount of stress. It's so stressful. But when you work with patients who have chronic health issues, and especially the hypermobile population, who are my favorite forever and always. However, they do cause me stress. We see the situation where this person has, for example, gut pain, and they have a change in bowel habit. And we play I call it a game. I don't mean in like a funny sense. I mean kind of, in a maybe dark humor sense. We play this game of like, is it HEDS stuff? Like, is it HSD stuff? Is it, one of their diagnosed condition stuff? Or is it something sinister, something else, something perhaps even like bowel cancer? And this is where things get hard, they get clinically complicated, and they get downright dangerous sometimes. So I want to just read actually a quotation from Deborah James. She was a dame in the UK, a woman in the UK who received a damehood, as they do over here. And she writes about her experience and her kind of like how she first presented with bowel symptoms. And this struck a chord with me because it sounds exactly like what I hear from my patients. And although most of the time it's nothing serious, if we say that, sometimes it is. And regardless with anyone, I don't care if the patient's 90, I think we need to manage everyone. Like, their life really matters. And like we want to protect their best health outcomes. However, especially for younger patients, we really, really need to be on it. And we need to not be missing cases where we could potentially, save someone's life, protect that person who maybe she's someone's daughter, or maybe she's someone's mother. I try and remember that every single patient I see, they're usually loved by people, and they matter, and they bring good into the world. So we need to always be taking everything so seriously and on the lookout for those scary and serious causes of symptoms, which most of the time are going to be nothing. But anyways, here's the quote, okay? Deborah James says, "I'm the perfect example of a hypochondriac. One that immediately thinks dizziness means a brain tumor, a cough means lung cancer, and blood in the stools means bowel cancer. However, years of CBT has meant that I've learned to rationalize almost every ailment-inducing symptom the last year of a change in bowel habits that I put down to too much wine, a new job, and stress of trying to be that full-time working supermom. If only someone believed me earlier that I wasn't crying wolf, when in my normal nervous GP question time, I tell the doctor that I think I have bowel cancer. I'm actually laughed at. Not one time, but 3 times over the course of 6 months, despite being reassured on numerous occasions that I must have IBS, hemorrhoids, or at worst, colitis. My blood test and stool sample came back normal, so everything must be fine. And yet I was still losing weight, passing blood, going what felt like 100 times a day, and feeling shattered." So this quotation really struck a chord with me because this is from someone who had bowel cancer and who died of bowel cancer. I believe she passed away when she was 40. And it was about a year ago, I think now. But anyways, this quotation could have been just as easily from someone who's hypermobile. I see patients all the time who have chronic diarrhea, who have issues with hemorrhoids, for example, and sometimes it is hemorrhoids causing blood in the stool. But what scares me is just when there's what I believe to be not careful enough management. So I'll see patients who tell me about all these symptoms, and people do tend to open up to me a bit. I think it's just because I'm lucky in that in my work as someone who works in the private healthcare system, I do have more time with my patients, and that helps patient safety immensely. But I'll talk with my patients, and they say, I was told that I had IBS through a phone consultation that lasted 5 minutes, and I had no testing, and we didn't really talk about anything like, the way that you've talked with me. And that always makes me scared. I don't like that. And that's why part of my work is that I do try and support patients and make sure, I'll tell the patient, look, I think this was okay if it's a situation where it sounds okay. Or I'll say, I am quite concerned about this. I am quite concerned that you didn't have time to talk with the doctor about the blood in your stool or whatever, right? So it's about that, it's about safety, patient safety ultimately is what it's all about. And with gut issues, it is very nuanced and very, very complex. And I do think that perhaps diagnoses of IBS, irritable bowel syndrome, they're thrown out like, I don't know, like it's a free, it's thrown out without the correct medical investigation that it should have a lot of the time. And you can go do research online. You can look into what a diagnosis of IBS should entail, but it's not just something that you can say without having checked that patient, without having done investigations, without making sure that they're safe. So anyways, gut issues. I'm going to talk about them here. I'm going to provide a lot of reasons why things might happen in hypermobile bodies and why things might be a bit weird. But at the end of the day, if you leave with one message from this episode, the most important thing is to know your normal and to know what's abnormal from your normal. And knowing your normal is so hard when you're a hypermobile person because your body's constantly changing. It's in a flux. You don't know if it's going to be a good day or a bad day, or, it's that, I talk about it being like a tropical island, like in your body, instead of having a constant climate, you have these, thunderstorms in the morning and sunshine in the afternoon and maybe a rainbow later, maybe followed by hail. Like it becomes unpredictable. But as much as possible, hypermobile patients need to be supported in learning what their normal is so that if something gets weird, they're able to clock it and they're able to flag it to their healthcare provider who they hopefully have, who is hopefully appropriately qualified and that they trust and that they feel able to communicate to them about this stuff. That is the most important thing. So that is my message for you. Now, moving on, there is an absolutely brilliant research paper. It's a narrative review. I believe it was published in 2022, and it's called Hypermobile Ehlers-Danlos Syndrome and Disorders of the Gastrointestinal Tract. What every gastroenterologist, I'm losing my words today, needs to know. If you are someone who's trying to get investigated for gastro issues, or if you're a gastroenterologist who's listening to this and maybe you keep having these like hypermobile people showing up and you don't know what's going on, that paper looks awesome to me. I've read through it a few times. I think it's really well written. I think it's very clear and it's very short. Who doesn't love a short paper? But there they talk really about the prevalence of different types of gut issues that we see in patients. We are seeing things like, for example, an increased rate of celiac disease potentially. We are seeing things like potentially an increased rate of intussusception, which is when the bowel kind of folds in on itself. And those are two examples of different kind of things. And that leads us into the next part of this episode where we talk about like what's actually going on. Why are hypermobile guts so weird? So here's my theory. Hypermobile guts are weird for two reasons. We have them, well, three, but we're going to start with two, okay? Firstly, there's the mechanical side of everything. So, and if you've been listening to this long enough, I always end up talking about mechanical issues and inflammatory issues. So your gut is a tube. It is a tube of connective tissue, which, as you can imagine, is not the best thing for a lot of people who have connective tissue disorders. I want to stress to you that you are like a donut. So if we took your body, and I promise this will make sense in a second, just bear me out. So just hear me out or bear with me or do both. It's up to you. You are a donut. So you have a tube. Your mouth is the start of the tube. Your bum is the end. And basically that space is hollow inside you. So if you imagine a donut, your body is like the part that you would eat, and your gastrointestinal tract is that hole in the middle. That's what that tube is. Your gastrointestinal tract is where your body has to deal with the outside world. When you eat food, you're taking the outside world and you're putting it inside you. And that's really, really cool in just normal physiology. I think guts are so interesting. But secondly, that's why we see a lot of these different types of issues with food sensitivities and allergies and all these different things, because you're being exposed to the outside world through your gut, because you, even though you might not have known it until right this second, you're a donut. Now, the problem is that the food, you don't just like take it and you don't just go like blip, like drop it in your mouth and then it just magically goes down. That's not how this works. There are many, many steps to getting food from here to the end of its journey. So starting at the mouth, if we look from a mechanical perspective, again, just talking about hypermobile patients and some of the mechanical issues they might encounter on the journey of food, you have to firstly chew the food. And a lot of hypermobile patients have issues with their teeth. We see gingivitis. We see patients who have lost teeth. We see all types of dental issues. We'll do a dental episode one day, don't worry. But we also see a lot of TMJ issues, which makes chewing food painful. So of course we have problems there to begin with. And that's without even considering about issues involving not feeling hungry. And we're going to get into some of the neurology stuff later in this episode. But you have to chew the food. You then have to swallow the food. Swallowing is complicated. It's a series of movements, which is incredibly complex. And it's one of those things, if it happens for you, you just take it for granted. But for patients who have issues with it, it's something which really does affect their quality of life and requires sometimes very complex medical management. And it's one of those things that I'm always looking out for in patients because I want to make sure that we catch it early. I don't like to miss things that can lead to problems, because then it sucks for the patient and it sucks for me. So swallowing issues are something I try to be very, very quick to identify. But some people have very, very mild issues. Maybe they'll just have a hard time swallowing a pill. Maybe their airway's a little bit different in terms of the anatomy, but other people will have very serious issues where they really do struggle to swallow anything. Anyways, so you have to swallow the food. Now, the food goes down your esophagus, and you might not know this, but you have like little valves along the way. So they're little like flaps throughout your body, and their job is to hold stuff in certain places. So you have little flaps, which are meant to, like, once food goes through it, hold it down in the stomach. And sometimes hypermobile people have issues with those flaps from a mechanical perspective with those valves. You're not going to be surprised. Sometimes they're hypermobile. And what this means is that food that has gone down and should stay down does not always do that. Sometimes it will kind of come back up, and that can present as different things. You can have rumination, where food is coming up all the way back into the mouth and it's actually undigested, so it's coming back up very, very quick. You can also have things like hiatal hernias, which is where one of the valves in your esophagus is not quite working as it should, and that food is coming back up and presenting almost as symptoms that we would refer to as heartburn. However, moving on, let's pretend that the food has made it to the stomach. The food then has to get digested in the stomach. Now, there's a whole biochemical situation that happens down here involving acid and all these other things, which is really cool. And we're going to set that to the side for a sec. But there's also a whole mechanical process, like where your stomach is literally helping to kind of smush the food. So your stomach does all these like squishing motions. I'm showing it with my hands if you're watching on YouTube. Hi. But like your stomach, it's squishing the food to try and further smush it so it can then go into your small intestine. So the food then gets into the intestines, and this is where things start to get, I was going to say more problematic, but there's problems along the whole track. So this is just like different problems, okay? But this is where some new problems crop up. So we do a lot of absorption of nutrients in the small intestine. It's very, very important. And unfortunately, sometimes hypermobile people do have issues with this. And this is why you'll see these patients with, like, instead of just having normal blood values for different vitamins and so on, they'll have like slightly low, but not that low that it's concerning, but just there'll be patients who they have things going on in their blood work that aren't causing them immediate harm, but we don't know why they're happening. That's kind of like a classic presentation that I see in my patients. But with the small intestine, we will have issues with vitamin absorption there, especially B vitamins. And I think that might happen partially, and this is just my hypothesis again, there's no research to prove this at this point in time, although hopefully there will be one day, but the food is moving either too slowly or too quickly through the small intestine and the large intestine. That's my thought. And let me give you an example. So imagine that you have a factory and a conveyor belt, and certain things need to happen along the conveyor belt at certain points in time. So let's pretend that we're making little, like, wooden fire trucks, I don't know, whatever we're making, the belt cannot move too fast, because if I have to assemble the truck and then the next person has to be like painting it and the final person has to like put a sticker on it, I don't know. If that belt is going too fast, it's not going to happen. The end product is going to look like a hot mess. But if the belt is moving too slow, then the person at the end of the conveyor belt, they might just go home at a certain point to go to sleep. So again, we're going to end up with a problem that product is not happening as it should. That series of events is not happening as it should. So this is why normal gut motility is very, very important. Your food must move through you at the correct rate in order for the correct things to happen at the correct time. We could kind of just end the episode there, to be honest with that. That is like gut function summed up, okay? Things need to happen in the right way at the right time, and stuff has to move through you at the right speed. Now, hypermobile patients classically will present, when we get to kind of the end product of human digestion, if you call it that. So we're talking stool. Let's use that word for today. But they will end up with a mixture, very often, of diarrhea and constipation, and they don't know which. But the question that I ask patients is, have you ever had a normal stool? Which seems weird, but if you're a hypermobile person, listening to this, perhaps this will actually seem like a very normal question to you, because so many of my patients look at me and they say, no, I do not feel like I've ever had a normal stool. And I've done social media content where I show like the Bristol stool chart, which has pictures of different types of stool and what's normal and what's considered constipation and diarrhea and all this different stuff. And like the hypermobile person's dream is to be, I think it's a 3 on that chart. And basically very few people are. Again, there are those hypermobile patients who have wonderful guts, and I hate you. just kidding. No, I'm very, very happy for you. I just wish that I wish all of my patients could have normal gut function. And of course, one thing I don't want to forget to mention in terms of serious things, and again, this episode is not comprehensive. We need to do a whole series on gut function. I would love if we could get someone on here who knows a lot more than me about gut function. But anyways, another issue I do want to mention, just because it shows up on social media quite often too, is something called gastroparesis. So this refers to when your stomach stops digesting food. So again, a lot of things have to happen to make that stomach work and to make food move down the digestive tract. And sometimes it stops. And this is incredibly serious. This can result in, I would say, a life-threatening. It is life-threatening if it's not managed appropriately, absolutely. But this is something which needs to not be missed. And so often I will see patients, and these are people who are losing weight and so on, but they're young and they're often quite slender patients to begin with. And then they're telling me, I've spoken to my doctor, but my doctor's ignoring me. And that's when I have to get in that position to say, you know what, we cannot be ignored here, because I don't feel happy with this management. So, I'm going to figure out what we can do, but we've got to sort this, because it can lead to this, basically the stomach not being able to work properly anymore. And then we have to, of course, look at different types of TPN and different nutrition options, which involve tubes and so on, which are wonderful for the patients who need them. But my goal is to always, of course, prevent people from getting to that point, ideally. And again, remember, I am a UK registered osteopath. I'm just trying to support my patients when I see that they've had certain things perhaps missed in their medical management. But does everyone get gastroparesis? No, they don't. Not every hypermobile person will get it. Do some people get it? Absolutely. And is it something we want to make sure that we're looking out for? 100%. And again, we will do a separate episode on that. But in short, if you're having people who are not able to keep food down, they're never hungry, they're not eating, they're having things, for example, a symptom of it can be that you are having food come up. So you're being sick with food and it's hours later, but it's still like, it hasn't been digested, if we don't get into too much detail there, but it looks like it hasn't really been broken down. Those are some of the symptoms of gastroparesis. Again, this is not an episode on that. I'm not going to get into detail here, but it's something which we really, really need to be careful to not miss in patients, and that every person should be aware of. And I think patients should be aware of these things because it helps the patient's health at the end of the day. And there's nothing wrong with being a knowledgeable patient. I love my patients who are knowledgeable. They teach me so much. I call them my expert patients, and we get to really work as a team, which I think is the best way to do healthcare. But yeah, gastroparesis, it exists. It really sucks. And we need to get better at identifying it in young people who look well, but who feel horrible before it gets to a point where it starts to cause a lot of significant harm. Now, I think we've talked about most of the mechanical issues. I'm sure there's stuff I missed. If I missed stuff, put it in the comments. Come, I don't know, find me on email, reach out to me. I love hearing from this community. But moving on to the inflammatory side. So we talked about the mechanical side. So that's the ability of the connective tissue to stretch and to compress and to function and move stuff where it needs to be. However, we start to get into the inflammatory side. We kind of touched on it a little bit with the small intestine, some of how the inflammation there. We didn't talk about the inflammation. We talked about how the speed of food moving through the small intestine can be problematic. But just to show how one part of the gut can have two different issues, you can also, of course, have inflammation in that small intestine, which affects nutrient absorption. So you can have mechanical issues, and most people will, interacting with inflammatory issues, which is what makes this so complicated. But if we look at inflammation for a second, we see, of course, a lot of chronic, what I refer to as like subclinical inflammation in these patients, or they will have episodes that would potentially result in higher markers of inflammatory markers showing up on blood tests if they were tested. But at this point, they feel too well, obviously, to leave their home. So they're kind of stuck there. And what I'm talking about, and many of you are going to be familiar with this already, but I'm kind of getting into the whole mast cell diseases and histamine area of all of this. So this is another area which is quite contentious currently. There are a lot of, unfortunately, medical doctors who seem to think that this is like a trend and that patients are coming to them concerned about this stuff because it's a trend. It's not. It's not. So mast cells are a type of immune cell, and they live in your gut and in your connective tissue especially. And I believe they also live in your brain as well. But I didn't double check my research before filming today. So we'll do another episode on mast cells. But anyways, mast cells live in different places in your body, which are hugely problematic to hypermobile people. And mast cells, when they sense something that they think is a threat, that your immune system thinks is a threat, they rush to the scene of the crime. So say, for example, I eat something that, let's say I have some spinach, and spinach is high in histamine. Who would have thought that a health food could potentially be problematic for some people? But mast cells will rush to the gastrointestinal tract, and they're going to start to degranulate and dump histamine, as well as a bunch of other things. But again, for another episode. Histamine irritates tissues. It does a lot of other things, but it is an inflammatory, it's an autocoid, which is halfway between a neurotransmitter and a hormone, but it is going to up inflammation at the site where it is being dumped, basically. So you're going to start to have a lot of inflammation as part of that reaction. And in simple terms, think of like, when a mosquito bites you and you get a huge welt from it, that, maybe it's a lot bigger than what you see on your friends or your other family members. That can be, in some individuals, a sign of something that's not quite right, potentially with their mast cells. Or they could just have a histamine intolerance or something on the other side of that kind of diagnostic spectrum. So we see issues with mast cells and histamine. I know I'm being broad here, but thank you for your understanding, because that's extremely technical stuff. And this means that we see in these hypermobile patients a lot of confusing stuff regarding food intolerances that doesn't make sense for a lot of the patients, and that often doesn't make sense for the healthcare providers. So these are patients typically who come to me and I say, okay, so tell me about your relationship with food, and tell me what kind of like different nutritional strategies you've tried or ways of eating. I'm not a big fan of the word diet. I kind of try to avoid it in my medical terminology, but I'll say, tell me about what kind of foods you eat or if you avoid any. And patients will tell me often, I've tried everything. I've been like pescatarian, vegan, gluten-free, lactose-free, keto, intermittent fasting. Like, these are patients who will come to me and literally list like every nutritional strategy, diet, way of eating, whatever to ever exist. And they're like, nothing seems to work. It seems like some things help a bit, but I'm so confused and I can't figure out what's going on. Now, my hunch is that often these people may have a sensitivity to histamine. So what I then end up talking with them about is how histamine can affect the gut and how we need to start thinking about that. However, it's not ever as straightforward as one thing. I wish it was. I would be so well rested. My life would be so simple, but it's not that simple. So of course, histamine and mast cell issues can play a role in some patients' gut dysfunction. And patients where I'm going to be like very concerned about this is where they're having extreme symptoms after eating. So this could be like debilitating gut pain. They're lying on the floor. They're not sure if they're going to have diarrhea or vomit, like these types of like Stronger reactions are things where I'm thinking more, potentially mast cell issues or histamine issues. However, there are many other types of issues that affect hypermobile people as well in terms of inflammation and the gut. Moving a bit further down the gastrointestinal tract, we end up at the end. And the most common symptom probably I do see in my hypermobile patients is diarrhea, although often they will have had constipation issues as well. But diarrhea, because it's stuff happening when it shouldn't and where it shouldn't, it starts to damage the tissue down there. If you're having chronic diarrhea over time, it is not kind to the patient's rectum. And that, again, we can have injury occurring and inflammation. They start to get very, very sensitized. And this is where, from an inflammatory perspective and from a chronic pain perspective, and this is mentioned in that brilliant narrative review that I referenced at the start, we can start to potentially maybe even have sensitization of different organs in terms of pain. When you have different injurious events, if we think of it like that, when you're eating food that's irritating your gut and you're having an inappropriate inflammatory response and you're having pain and nausea and diarrhea, that's an injury. It's like an ankle sprain. It's the same thing, different system. But that can potentially result over time in a sensitization of tissues in that region, which is maybe potentially partially why patients' symptoms seem to get worse as they get older. Now, on top of all that, we do see increased rates of inflammatory conditions in patients with HSD and HEDS, including celiac disease. And research is still emerging, but the research that is there suggests that this is the case. And of course, I want to stress that with celiac disease, although there are blood tests to test for it, these blood tests are not perfect. And there is a percentage of patients who will have celiac disease who will be missed on the blood tests and who will only show up if they have a small intestine biopsy. However, that's expensive. Our public healthcare system is going to do that? I don't know. And if you're a hypermobile person who's trying to kind of avoid surgical procedures, maybe because you're worried a bit about outcomes from that, should you be having a small intestine biopsy? Do the benefits outweigh the risks? And maybe is it better to just go onto a celiac diet as a trial? Again, I don't know. I'm not a gastroenterologist, but what I do know is we see increased rates of celiac disease in hypermobile people. We also see increased rates of inflammatory bowel disease. So this includes Crohn's disease and ulcerative colitis. But in particular, we see an increased prevalence of Crohn's disease in hypermobile individuals. And again, we don't know if one's causing the other, what exactly the interaction is, but we do know that we see that there. So again, that's just further evidence that we do have inflammation in the gut, which affects how people feel and affects how you digest food. And finally, the last thing, which I'm going to touch on very, very briefly, because I don't want to make this episode too long, because I think it's going to be a pretty long one, but we have the neurological component. So your gut is controlled by your neurological system. I'm specifically your autonomic neurological system. And I'm sitting here digesting food, and I'm not having to say like, okay, stomach, go. Okay, small intestine, do your thing. Like I'm not having to like control my gut. It's doing stuff on its own, luckily for now. Yay. However, how does that neurological control happen? That's not something we think about enough. And one mechanism through which that neurological control happens is a stretch reflex. So the tissue in the gut, when food goes through it, it gets stretched. And the stretching is what starts to stimulate the mechanoreceptors. So these are little bits of nervous tissue that are sensitive to certain types of mechanical stimulation. So in this case, when they experience stretch, that's when they start to fire their signals. And if you have someone with a hypermobile gut, if their gut is extra stretchy, are those little neurological stretch mechanoreceptors that are sensitive to stretch, are they going to be receiving the same information? Absolutely not, as someone who has normal connective tissue in their gut. So again, that normal person, they're going to have, say we both eat a burger, normal connective tissue person, they eat the burger and it's going to stretch their gastrointestinal tract the right amount in the right way at the right time, and they're going to get the right signals so the right thing happens. The hypermobile person has the burger, and then their gut is not going to get the right amount of stretch because it's too stretchy, it's too lax potentially. They're then not getting the right information, and then their body can't do the right further actions. So it's a whole series of knock-on consequences. So neurological function is a huge issue. And there are even things like visceroptosis, which refers to organs potentially sitting slightly lower than they should. And of course, we have organ prolapse as well, which is when organs are moving further down, especially in the pelvic region. We talk about pelvic organ prolapse. And will the position of an organ potentially affect its function in terms of neurological supply and tension on the nerves? Potentially. So it all gets really complicated. And with the gut, we need to think about, in summary, mechanical issues, inflammatory issues, and neurological issues. Now, what is something that you can take away from today? What is something that you can do so that you leave on a positive note and you feel like you can do something maybe while you're waiting for that doctor's appointment, or maybe to talk with your doctor about it at your next appointment? Here's what you can do. Firstly, think about your normal. What's normal for you? What's not normal for you? Has stuff that's not normal for you been happening lately? If so, definitely please go speak to your doctor, or speak to someone who's a qualified healthcare provider who cares, who can then support you in speaking to your medical doctor. As well, I think it can be helpful to be aware of histamine content in foods. And again, I am extremely cautious when it comes to anything involving eating disorders. They are they kill people, they're harmful, they're dangerous, and we have to be so careful when talking with a patient population who which seems to have a higher prevalence of them. However, my thought on eating disorders in hypermobile patients is, how can you not have a complex relationship with food when you keep trying to eat it and you keep feeling bad when you eat? Of course, that's going to complicate things. So something which I, in my clinical capacity as an osteopath, I very carefully try to support my patients in looking at and considering, and ideally speaking with a gastroenterologist about, is looking at low histamine foods, not in a restrictive sense, not in a sense of avoiding it entirely, because spoiler, histamine's in everything, but of saying, you know what, maybe I'm not going to eat a chocolate bar at 10 p.m. at night because I know my histamine levels are going to be a bit higher due to my circadian rhythm and how that affects that. Maybe I'm going to have one square of chocolate earlier in the day. Or maybe, you know what, I hate spinach. I'm not going to eat spinach anymore. I'm going to have pak choi and Asian greens instead because spinach is high in histamine and pak choi is low. Again, don't ask me why. I don't know. But making those little kind of food swaps, I think, can be a really helpful place to start. I will link a histamine food list in the show notes. Again, I urge you, if you're someone, especially if you're someone with a history of disordered eating, please speak with your healthcare provider who's looking out for you, hopefully. But it can be one of those things which starts to make everything make sense for patients. And I think it's just so helpful to be aware of, okay? But I'm not in any way advising a restrictive diet to anyone. The show is not medical advice. This is literally my thoughts on a bunch of stuff for informational purposes. Now, moving on as well, eating in smaller meals at regular intervals can be helpful. So if we think of that conveyor belt of chaos, we have stuff moving too fast, too slow, and all of this going on, it can be helpful sometimes, I think, to try to impose some regularity onto it. Now, of course, if you're someone with ADHD, this really complicates things. And I think it's about a third of hypermobile people have ADHD. So this gets really hard. But if you can try and say, look, I'm going to eat 4 meals during the day and they're going to be at regular time intervals, so my gut kind of can start to learn what's happening. I'm imposing some structure on my hypermobile and kind of chaotic gut. That helps a lot of people often. And finally, a fun fact that many people won't be aware of: many probiotics are histamine producing. They actually are going to do the opposite of what you want. So there are some probiotic supplements that are histamine sequestering or histamine neutral, and those are what you want hypermobile patients to be having. I cringe when I think of all the years like I did this. Like I would just buy probiotics, just look which ones are on sale, what's on the shelf, what marketing looks cool, whatever. It's not that simple. So please, when you're buying probiotics, firstly, make sure that the subspecies is listed. So it should have like the name of the probiotic itself, but then it should have a little series of like numbers and letters at the end of it. Please look for that, because that's a sign firstly that it's a good quality one, because the subspecies matter, and different subspecies can do different things, even within the same species. Secondly, of course, be sensitive to the fact that you need to be careful which ones you're taking. So you can do stuff like what I do. I literally call probiotic brands and I like try and speak with their nutritional team or go do research online. But definitely look into which one might be right for you in terms of a histamine perspective. And finally, of course, be thoughtful about what you're taking and why you're taking it. So even with something like a probiotic, I would say take it for 3 months and try and have some type of an outcome measure. Maybe for you it's diarrhea, has that frequency decreased? Like, what are you trying to achieve by what you're doing? Don't waste your money on things. Like, be thoughtful about it. And one last bonus tip, it might be worth looking into a supplement called diamine oxidase. So diamine oxidase helps to break down histamine. And we touched on histamine briefly. It'll get its own episode one day. But diamine oxidase literally goes and it mops up the histamine. So the mast cells make the histamine mess. And the diamine oxidase goes and cleans it up and puts it away. However, in hypermobile people, we often see issues with diamine oxidase. Their body's not producing enough of that enzyme. So diamine oxidase is available as a supplement. Again, be careful with taking supplements. Treat them like medicine. Speak with your medical doctor. Make sure they're not going to interact or cause any issues. However, taking diamine oxidase can make a difference for a lot of hypermobile people. And it's something which is one of those supplements that I certainly put up there for a lot of my patients in terms of recommendations. And it seems to do what it says on the tin. And there's some good research emerging. So that's exciting. I hope you've learned something about gut issues today. I hope you've managed to stay with me. And I hope it's been as straightforward as I could make this complex and convoluted subject, which really fits with hypermobile guts themselves because they are complex and convoluted often. Of course, if you have any questions, please don't hesitate to write in, and be sure to check out my Hypermobility HQ Discord membership. It is awesome. We get into the nitty gritty on there. It's nice having kind of more time in terms of these consistent twice a week lives that I do. And of course, the forum is amazing. And I think there are still some founding membership rates left. So definitely go check that out because they are limited, and I think it's really, really helped a lot of people. I've gotten so much awesome feedback on it, and I'm happy because it feels like it's the best corner of the internet ever for hypermobile people, and I'm so proud of it in all honesty. But yeah, thank you for joining me, and see you next time. Take care.